Is everyone here comfortable talking about contraception?
Yeah.
Yeah.
True.
Okay. We want to just see what you guys know before we go into our poster beforehand. So we're going to do like a true or false game. So put up true if it's true, false if it's not. Do you want to read the first one?
Sure. Okay. True or false? Anyone can buy Plan B one step over the counter regardless of age or gender.
Oh.
Wow, so we have some mixed signals in this group.
Why do you say false?
You have to be at a certain age, like at 17, something like that.
Actually, the answer is true. But many people think you need to be 17 because it's a new rule change that they just decided to change
Since when?
recently, actually, yeah.
Okay, so question 2. You can only take the morning after pill the morning after birth control failure.
True or false?
False.
We got false all around? Okay, you guys are right. You can take it the second after and some up to 5 days or 120 hours after birth control failure, depending on the method you choose.
We'll talk about those methods later.
You can take emergency contraception right before unprotected sex and you are protected from getting pregnant.
False all around?
False.
Okay. There's a limited amount of times you can take emergency contraception. Meaning, like, you can only take it a couple of times, or false. Yep. So it's actually the same thing that's in your, like, a normal birth control pill, so you can take it as many times, but it shouldn't be used as a regular birth control, so that's kind of where that is. One more question.
Emergency contraception is not the same as the abortion pill. True?
Do you
Okay.
know why it differs?
The abortion pill is like once you're pregnant you can take it, and it's like super expensive.
Yeah.
And the emergency contraception just prevents pregnancy all in itself. It doesn't allow, like, an organism to actually begin, like, to live, so.
Before we get into this poster, do you guys know the different types of emergency contraception available?
Showing it.
Yeah.
Mm-hmm.
Yes.
Yes. Okay. So you have hormonal and non-hormonal, the pill and IUD.
Yeah.
I'm gonna start. We'll tell you
So
this.
for hormonal pills, how they work, it uses high dose hormones to prevent pregnancy, and you can take within 3 days or 72 hours. You have the progesterone pills or Plan B one step, My Choice, and Next Choice. The effectiveness of them, taken within 24 hours, the pill is 95% effective. 5 out of 100 females will become pregnant. Taken within 72 hours, the pill is 89% effective, so 11 out of 100 females will become pregnant. Research shows that the pill loses effectiveness in women with a greater weight, a weight greater than 165 pounds, and may not be effective over 176 pounds. You can buy it over the counter at a drugstore, Planned Parenthood, online, or health services. It's usually $25 to $60 and can be covered by insurance, but also check with your insurance just to be safe first. Symptoms: nausea, vomiting, breast tenderness, abdominal pain, headache, dizziness, fatigue, and changes in your menstrual period. Combination pills, estrogen and progesterone. Using your own birth control at a higher dose, it is not recommended but has been shown to be effective in preventing pregnancy, but it isn't as effective as progesterone-only pills and can cause more negative symptoms like nausea.
One thing I want to add to that is if you're over 176 pounds, they recommend doing the copper IUD instead, because
That doesn't really like matter weight-wise.
It-
Because the hormone gets absorbed into your blood, and so may not be enough hormone for your body weight.
Yeah.
So you want to do those.
did you go over Ella?
No.
Okay.
If you want.
So Ella is a non-hormonal pill. It uses ulipstrol acetate to block your body's own production of hormones. And it's the most effective within 5 days. Like at day 5, it's more effective to use the non-hormonal than the Plan B one-step pills. 2 to 3 days, Ella is 95% effective, and then at 5 days, it's 85% effective, compared to the hormonal pill that was only it's not recommended after 5 days. You can buy Ella at Planned Parenthood, campus health clinics, and urgent health centers. You need to have a prescription to get it. You can't just get it over the counter. The cost is $35 to $60, and the symptoms are headache, nausea, stomach pain, menstrual pain, cramps, tiredness, and dizziness. Okay, the copper IUD.
You want to do that?
We pretty much already went over it. Emergency contraception in general works at either stopping the release of the egg from the ovary or the fertilization of the egg and the sperm from even occurring, or stopping the egg from implanting into the uterus. If you are pregnant already or breastfeeding is not recommended to take any of this.
It won't work if you are already pregnant.
Well, yeah, it won't work. And then you should consider taking emergency contraception if you're scared of getting pregnant, if your condom broke, forgetting to take your birth control, if you had unprotected sex, consensual or non-consensual, and then the fears that you might become pregnant.
Okay, so the second type of emergency contraception that we talked about was the copper IUD, also known as Paragard. So it's a T-shaped device, and it's placed into your uterus by a practitioner. It prevents pregnancy by stopping the fertilization of an egg and sperm, and may prevent implantation of the egg in the uterus. Advantages of using this method is that you can use it as a long-term type of birth control, and use it up to 10 years after. So that's a picture of it right there. So that sits in your uterus. So effectiveness. At 5 days or 120 hours, Paragard is over 99% effective. 1 out of 1,000 people will become pregnant. So that's a pretty good effective rate compared to the other options. Where can you buy it? You need to make an appointment with your practitioner, like a gynecologist or Planned Parenthood, health centers like that, and they'll insert it for you. The cost is a little expensive. Maybe your insurance might cover it, but it's from $0 to $1,000 depending on insurance and where you go to get it. The symptoms are anemia, back acne, spotting, cramps, inflammation of the vagina, pain during sex, severe menstrual period pain, and heavy bleeding. So you just kind of have to figure out what one you want to use, kind of have to weigh out the positives and negatives and where you are in your life. I mean, if you're going to be 10 years, you don't want to have a baby, maybe this might be a good option for you. Alrighty, so you want to. So what are the two, we're just going to assess a little bit. You guys learned some stuff from our presentation. So what are the two types of contraception, emergency contraception?
Hormonal and non-hormonal.
For pills.
For pills, and then what's the other one?
The IUD.
Which what one is most effective?
The IUD.
IUD. Yeah. Where can you get it?
Oh, you have to make an appointment with your gynecologist.
Yeah, for the IUD. But if you just want to get let's say Plan B, where would you go?
Pharmacy.
Awesome. And anyone can buy it. Doesn't matter if you're a female or a male.
Do you guys have any questions about any of them?
No.
No questions?
So
I think it's important to know this stuff because it's called emergency contraception. You kind of want to know what you want to do right when you need it, because this thing, like, the sooner you do it, the quicker, the better it works. So if you know what your plan is, you'll have a better outcome.
okay, cool.
Thank you.
Ciao.